You may hear me sharing a lot on phlegm suction in my blog as well as in my YouTube videos when I talk about my mother's Alzheimer. And you may wonder, where on earth would a person with Alzheimer or dementia ever require phlegm suction? The answer is, phlegm suction relates to those who develop difficulty swallowing, which sometimes occurs in the end stage of Alzheimer. This condition is known as dysphagia. The reason why you may not be familiar with the use of phlegm suction in Alzheimer is because most of the time, the person who have Alzheimer will never get the chance to get to the stage where they will require phlegm suction. Let me explain further. At the end stage of Alzheimer, some would actually start to choke, especially when they are taking fluids or have problems swallowing even their own saliva, phlegm, or mucus. Usually we would swallow any secretion of food or fluids to our stomach. But in the case of a person with end-stage Alzheimer who develop dysphagia, these often end up in the wrong track. Means they, instead of swallowing to the stomach, it goes to their lungs. Because of the sensation of fluid or food getting into the lungs is very painful, even though it is a small amount, they will often prefer not to eat because it's very uncomfortable. It could also be because they have forgotten to eat and or no longer know how to crave for food. By the time they develop swallowing difficulty, often is already at the end or advanced stage of the illness. At this stage, the standard protocol in many places is to obtain evaluation from a speech therapist and to try hand feeding. I want to say that I've tried hand feeding, it did not work. This often fails because we cannot reason with a person with Alzheimer or dementia to eat or swallow. If they don't want to do it, it means that they don't want to do it, or it's because they don't know how to do it anymore. And as our loved ones start to lose weight drastically and become weaker and refuse to move much, grief-stricken family members will be then referred to hospice care. It will be then the end. The aim will be then to keep them to comfortable, either through using sponge bath, putting a few drops of water into their dry, parched lips because of a lot of heat built up in their body as a result of severe dehydration, and the use of painkillers and sedatives. When my mother reached that stage in Thailand, the specialist who treated her from the private and government hospital told me nasogastric tube feeding. Nothing was ever mentioned about hospice, nothing was ever mentioned about the end. They said that they have obligation to, if she can't eat, they have to try to use a device to enable her to eat. Denying them of food or sort of like making them comfortable is not the option, because from what they can see, my mother can still survive. After my mom is fitted with a nasogastric tube, she goes under the robust Thai healthcare system, where doctors and nurses are well familiar with the procedure concerning nasogastric tube feeding and any complication that possibly could come from it. Do you know, whenever I bring my mother to hospital, it is really not uncommon for me to see people with the nasogastric tube in them. Of course, most of the time they don't have Alzheimer. Most of them, they have their cognitive still intact, but it's not unusual. The concept is, if you can't eat, then you put in the tube until you can eat. I mean, other normal people, until they can eat. So they know that they are very familiar. Doctors and nurses are very familiar. Whenever I encounter a problem and I ask them, they would be able to give me a solution. For example, when I voiced my concern that my mom would definitely try to pull out the tube, they told me no worries, that they have hand mittens for her to wear. She can always use a hand mitten. A lot of phlegm, no problem, do phlegm suction. The moment they see, they know. And with time, my mother regained her energy. You know, previously when my mother was still eating by mouth, when she didn't have dysphagia, she had high blood pressure, cholesterol, which we have problem controlling, because as I mentioned, you can't reason with them what to eat and what not to eat. If they don't like the food, then they won't eat it. So her blood pressure, her cholesterol were going up and up, especially the high blood pressure is like not under control. And then she was also showing signs of diabetes. Actually, she had diabetes right before she had that condition. And she also had liver cirrhosis because she had chronic hepatitis B, which had turned acute 5 years ago, but then it has moved back to chronic state. But we had to monitor her liver cirrhosis with the medication. With tube feeding, when my mom had to be placed on tube feeding, because the food, we source it from the hospital, and there's a lot of demand for the food, because each day the hospital have to do in 2 batches, and there are a huge stack of food, because there are many people who ordered from them. These food are all dietitian approved, and for the case of my mom, the one she's having one is for diabetic diet. Now it's 8 months in, about coming to 9 months since she is on tube feeding. In the checkup last month, her blood pressure, cholesterol and blood sugar are now well under control, moving down already. The virus count in her liver is now negative, means they're no longer able to detect in the blood test. This is the power that nutrition has done to help her. Had I not been staying in Thailand, my mom would not live long enough for me to see this and for me to share this with you. That's why I wish to bring this to your knowledge, that if your loved one with Alzheimer or dementia can no longer swallow, it need not be the end. But if you were to go with the route to actually put them on tube feeding, there would be a price to pay. I would really have to say that they really would require a high level of care. Most of the time, nursing home and memory care centers would not support tube feeding because they don't have a resource. You literally actually need a dedicated resource to take care of them almost round the clock, because there will be more bed bound, and because of the dysphagia, they would have problem swallowing anything. That also means their saliva. So you will have to monitor them, because there's also a danger of choking. But it is nothing alien in other illnesses with dysphagia, because in other illnesses with dysphagia, this is a well-known fact, and these conditions are also being managed, and people with dysphagia are also being very closely monitored. So I know that, of course, for those of you who is actually seeing this, you won't be in Thailand. You most probably are not in Thailand. And what I could say that is okay, because if you wish to go that route, you will need to turn to other source of support. Means the support group has to be outside of Alzheimer and dementia for more information. I want to say that actually a good place to start would be in the ALS forum and support group. For those of you who are not familiar with ALS, it's a motor neuron disease. And a very famous person or they call it the Gehrig disease. A very famous person who have it is Stephen Hawking, the famous physicist. But Stephen Hawking is very unlike anybody who have ALS, because he is the only person with ALS that could live with that condition for more than 50 years. For most people with ALS, the life expectancy is only 2 to 5 years. So difficulty in swallowing exists in other illnesses such as motor neuron disease and complications from stroke. There are people I know who had stroke, and the stroke actually have affected their part of the brain that control the swallowing, so they could no longer swallow. They are fitted with nasogastric tube. Regardless whether the difficulty of swallowing or dysphagia is happening to a person with Alzheimer or ALS or with stroke, the issue is the same. The brain no longer can command the relative muscle and the reflexes to do the swallowing of secretions of food. Means that because swallowing is a very complicated process, so it no longer can work anymore. It's the same condition actually, but it's only in Alzheimer. Alzheimer is the only condition where dysphagia exists, where feeding tube is being discouraged, and there's no support given for anybody who wish to put in a feeding tube. That's why I know how it feels, the grief and the helplessness. That's why I actually start putting a lot of videos on this to share the knowledge. I want to share a bit on what I learned from the ALS forums and support groups. In ALS, if a person have ALS, the doctors who are treating them would recommend a feeding tube. That's why initially when I wanted to research more on feeding tubes and phlegm suction, the only videos I could find that talk about this and share about this are from people with ALS and gastroparesis, a kind of disease where the stomach is paralyzed. It's also a fatal disease. So now I'm no longer active in Alzheimer's support groups, because I noticed that whenever anybody in the support group brings out about feeding tube, everybody would discourage it. That is the level, that is the understanding now at the moment. But in the ALS group, it's totally different. I learned a lot from them. And I want to say that I'm also very inspired by people who have ALS. You know, ALS is a very devastating diagnosis, because unlike other illness, ALS is 100% fatal. In the ALS world, dysphagia is not a big deal. Cannot swallow, cannot talk, no big deal. If they can't swallow, they usually have a PEG tube or a gastric tube surgically placed. Sometimes even before they develop that problem, their doctors will have told them that this is going to happen, and then they actually already have the tube placed just in case. And there are also people who, and when if anybody were to pose a question whether or not they should do a feeding tube, very different from Alzheimer group, you will find that most of the answer given is to put the feeding tube. Because when the time, even by people who actually initially, they even shared, because they really shared from their heart, that's why this group really touched my heart. I'm really inspired by them. They say that some of them shared, they themselves as a patient, they say that in the first place, in the early stage of their, when they first receive that diagnosis, right, when they still can swallow, they actually have a sort of like a medical directive to say that they are going to decline feeding tubes and breathing machines and all these things. But when the time comes when they no longer swallow, the sensation of hunger is terrible, and they change their mind. They have a PEG tube surgically placed. Because in ALS, their mind is perfectly clear. They can make the decision for themselves. They know the sensation and they are able to describe them. So for most of them, those who have declined, eventually they will agree to the feeding tube. From the experience shared by these patients themselves, I gather that they have no regrets. I've not seen anybody who say they have any regrets. Because they say that feeding tube gives them a better quality of life for the remaining lifespan that they can have. They need not worry about choking or getting enough hydration or nourishment, because this is taken care by putting in the food and the fluids directly into their feeding tube. In fact, they would, while they still can, they will occasionally indulge in a few bites of their favorite food. They can eat without feeling guilty. They can eat without worrying that they are not eating enough. If they feel that they don't have enough hydration, they put the food in using the PEG tube. So when they cannot swallow, in the ALS world, phlegm suction is a norm of life. It's normal. Because you see, when we no longer can swallow anything, what happens that when we lose the swallowing reflex? My mother's GI doctor said that every day we produce 2 liters of saliva. So where is that going to go if we are not able to either swallow them or spit it out? It's going to accumulate. Without constant suction, it's very easy for these fluids to go to the lungs and cause aspiration pneumonia. So most of the time, they are very familiar with phlegm suction. In the end, a person with ALS often pass not because they could no longer swallow, because to them that is one of the least of their problem. They just have a feeding tube. But they actually pass because they lose the ability to breathe, and they decide to decline a tracheostomy and being fully a ventilator. Because once they put in a tracheostomy to help them to breathe 100%, right, they would require 24-hour care. Means the caregiver cannot leave the site. So most of the time, they can't have that kind of resource, because you have to have a person. You can't even like sleep when you are next to them. You know, you have to be 24 hours watching over once they put in that they say is fully invasive, and that itself is considered the deciding factor whether or not they want to actually continue or not. Feeding tube is not. It's one of the least of the problem. So you can see the condition is the same. The illnesses are different, but only in Alzheimer or dementia, feeding tube, which is a lifeline to allow them to continue to live, is being discouraged, and there's not much support for this.